Hello everyone, so welcome you all to Ashok Tutorials, Meghalaya's first attempted channel. So today we are going to discuss, Chapter 4. What is Chapter 4? Primary health care, meaning and scope, healthcare setup in rural and urban areas. Alright, let us see what we have. So as we go down, and yes, of course, this is class 10 health education. Alright, so let us see primary health care. So what do we understand by primary health care? So let us read and see what we have. You must be, this one we will see. You must be aware that nearly 80% of our population lives in rural areas which largely consist of villages. Most of you might have seen a village. All villages are not well connected by roads or public transport. Most people do not possess adequate health information and are tradition bound. Their living conditions are not as good as in developed towns. They never have a safe water supply and houses are mostly kacha, ill ventilated and without proper drainage. Very few houses have a latrine. There is no legal agency to clean the road, etc. Such conditions are not conducive to health and healthy living. So now what do you understand? It says that how many percent of Indian are living in village? 80%, alright. And rural areas means the village area or the backward areas, alright. Village area is known as the rural areas. Then all villages, in village what problem we have? We have problem of transportation, right? We don't have enough good roads. We have only muddy or kacha road, right? Then there are not enough vehicles, right? And those who stay in villages, we know that we don't have good health conditions, right? The health of the people is not so well, and we also know that we have water problems, shortage of water in the villages, and the houses in the villages are kacha houses, ill ventilated means with poor ventilation. There is no enough ventilation, and also the drainage system is not well defined, all right. And very few houses they have the latrine or the toilet, which means in villages, there are no toilets. In most of the villages there are no toilet, which means open defecation they practice. So now Swachh Bharat, right? So accordingly we are progressing towards a better India, right? So there is no agency to clean, and there is no PWD and all in the village level. So such conditions are not conducive to health and healthy living, and these conditions, because of these conditions the people living in village they suffer a lot. Now the people in the rural areas are not fully aware of the available health services nor the various national health programs. The participation of the village community in programs, the participation of in health promotion is negligible. Very few seek medical aid in illness and seldom bother to avail the health promotive and preventive services. Now you see, it is saying about the lack of awareness among the villagers, which means in villages there are different type of programs or awareness programs or campaigns are organized. Then what happens is people they do not participate. So people should show interest and they should participate, because they are educating the villages, they are educating the villages about the different government schemes, different government programs, right? Different government programs and schemes, and very few people they take medical help. In fact they just ignore the medical aids, all right. Then what are some of the medical benefits which we are getting in Meghalaya? So let me show you. See, we all have got health card, right? MHIS we call it, right? MHIS. See, MHIS, how does it look? It looks all right here, mega health insurance card. So this one you can see here, right? This one. So we all know, what do we know? That we are eligible for availing the health cards. So we can avail the health card which is given by the government of Meghalaya, right? See, so when you browse through, you will find that there are we call it MHIS card, right? Health card, health insurance card. So according to the health insurance card, now the people can avail what? They can avail the health benefits. All right, they can avail the health benefits, and which cover sum of about 5,30,000. Now 30,000 is added extra. How? The people in their card balance, it is 5,30,000. So that 30,000 is for OPD. What is OPD? OPD is uh, outpatient department. All right, outpatient department, which means when you want to avail the benefit of those 30,000, you don't have to be admitted in the hospital. But however, if you want to utilize that 5 lakhs which is deposited in your MHIS card, you have to be admitted in the hospital. All right, which means only when the individual needs aid, when operation or surgery or anything serious has taken place, then only you can utilize that 5 lakhs. But in order to utilize that 30,000, you can use it even for your OPD visits. All right, so I hope that all of you are aware of MHIS card, mega health card, and you have made it. If you haven't done it, please visit your nearest civil hospital and make the card as soon as possible. All right, so therefore, keeping in view the above fact, our government has envisaged a package plan for delivery of health services through primary health center. So you all know what is a primary health center, right? So we all have primary health centers, we all have civil hospitals, right? And we go and take part, or we get ourselves treated in those, right? The PHC is usually located in the block headquarters. Where are PHC located? It is located in the block headquarters or any convenient places. All right, and it is well connected with other villages and referral hospitals. And what happens, these PHCs are connected with the villages and referral hospitals, which means the PHC in Ningmandal will be connected with the civil hospital Williamnagar. So let us see some of the list of the civil hospitals in Meghalaya. So let me write here civil hospitals in Meghalaya. So let us see. So you see here, which civil hospital is this? Civil hospital Shillong, right? So we have Shillong hospital, then we have Tura civil hospital, then we have, see here you can see the district and different type of civil hospitals which we have. See all this list you can see, right? So whenever you get free time, please browse and know. In every district the government have tried their best to locate a government hospital so that the average people can go and do the health treatment, right? All right, let's go down now. Let's see. All right, this chart you please read by yourself. All right, this chart you try to read by yourself. I'll go to the meaning and scope. So the PHC, what is the full form of PHC? You have to remember this very nicely. The primary health center. So primary health center is an institution for the promotion of both health and welfare of the people in the area of community development block. It is the smallest agency adopted to serve the public health needs of rural areas, covering a population of 60,000 to 1 lakh, which means, or before that, the PHC is the locus from where health activities radiate to the remotest villages in the area through sub-centers. Great. So now what happens, we have got PHCs, right? So in every PHC is connected with the government hospitals, right? And you know what is the number of population which PHC cover? One PHC will cover up to 60 to 1 lakh population or people will be covered in one PHC. All right, and it work along with the sub centers. So shall we see about Williamnagar? Yes, let us see. So let me type here. How do I type it? PHC Williamnagar. Let us see what we have. So list of PHC health center, primary health center. See now, here you can see a very beautiful list, right? So what do you see? Name of the block, then name of PHC, serial number, and name of subcenter. So suppose if we talk about, let's directly see, in William Nagar we have got three blocks: Rongjeng block, Songsak block, and Samanda block. So if we are talking about Samanda block, in Samanda block what we have, how many PHCs we have? Let us see, we have three: Bansamgre PHC, we have Samanda PHC, and we have Negmandal Gray PHC. Alright, so these are the three PHCs under Samanda block. Alright, now in Bansamgre PHC, what are the different type of subcenters? In Chiadang there is one, in Mandalgre there is one, in Thombolgre there is one. So three subcenters under Bansamgre PHC. Now under Samanda PHC, how many? Gtokgre and Dolwari, two. Then under Ningmandal Gray PHC we have Bolkan Gray and Sampal Gray. Alright, so this is how we come to locate like what are the PHCs and what are the subdivisions or subcenters. Great. So I hope it was clear. Nice, no? Great. So let us see here now. So they provide a package of integrated health, both preventive and curative family planning and nutrition services to the community. In addition to PHCs and subcenters, there are other agencies like dispensaries. We have dispensaries means pharmacies, alright, supplied with both the indigenous and the modern medical system within the block. Alright, so you know the PHCs, they help in caring of the patient, they help in family planning, and they help in guiding or giving the nutrition of the community or of the villagers. Alright, they guide them. The PHC provides accommodation for an outdoor dispensary, so they also give accommodation. Accommodation means what? Accommodation means a place to stay. A consultation room, they also give a consultation room or have a consultation room. Then they have maternal and child care, maternal and child health services, MCH, maternal and child health services, and family planning services. Alright, PHCs. Minor surgeries, so small surgeries, like suppose somebody went to cut the jungle and they got cut, or got stung by bee, or fall down and got fracture. So those small things can be treated in the PHCs itself. A small laboratory also they have in order to do small type of test like malaria test and all, and a ward of at least, and they have 4 to 6 bed. Alright, they have, it is like a small hospital, so they have 4 to 6 beds. Each center today has at least 6 or more subcenters on an average. Alright, so each centers they have got different type of subcenters. Now functions of primary health center. So what are the different functions they perform? Let us see. Medical care. The nature of medical care is elementary and provides emergency treatment of minor ailments for the ambulatory patients as outpatient. The treatment given is also associated with health education, so the treatment does not become an end in itself but an introduction to prevention. All right, so they give medical care. So medical care, it can be OPD. All right, it can be OPD, which means the patient can come, take the medicines, do the checkup, take the medicines and go, or they can, if the case is serious, then they can stay for a day or two as well. Now control of communicable diseases. We know there are different type of communicable diseases like tuberculosis, then malaria. So what happens normally, the health staff keep a surveillance on the outbreak of communicable disease, and they particularly malaria. So they also have mentioned malaria. During the surveillance, they specifically ask about fever. So when somebody is suffering from malaria, they will have rise of temperature of their body. They will have high fever, right? You may have seen on certain days a statement that by the side of the main door to your house, this is a record sheet of the visit of the health workers to your house. So now the people in the villages, the health officers, the nurses, the doctors, the compounders, they come and visit us. They come to the village and see like if anybody is having fever or they are having any type of difficulty or any type of diseases, and if anybody is found, they keep the record. All right, they keep the record and do the treatment. Now, maternal and child welfare services and family planning. What is maternal? Maternal means the pregnant mother, the taking care of the pregnant mother. All right, so MCW services are a direct special services to all mothers and children to attain total well-being of the child. Special attention is given to pregnant women so that they can take care of themselves and their newborn babies. Now, beside family planning services are also integrated with other programs. Now, what happens, maternal and child welfare services and family planning is very important for the pregnant mothers, because it gives the treatment or the service to both the pregnant mother as well as to the newborn baby. All right, so it is very good initiative by the government. Now, environmental sanitation. So sanitation means what? Sanitation means cleanliness, right? So it includes the provision of safe drinking water supply and sanitary disposal of waste products. See, number one is safe drinking water. We all should have safe drinking water, right? And sanitary disposal of waste products. So it also includes disposal of industrial waste. The sanitary inspector of PHC, who is inspector, he's an officer, right? He or she is an officer. With the help of village panchayat, the sanitary inspector, with the help, or they work along with village panchayat and other community leaders, and plan and guide the general public. The sanitary inspector has got powers to invoke local by laws, and this sanitary inspector have got the powers, all right, in order to guide the local people and to take necessary action if he or she feels. School health and nutrition education. Now, what role does it play in school health and nutrition? This service is concerned with child's growth and development. See, we all know that the growing children, they come to school and study, right? So their physical health, mental health, emotional health, intellectual health, social health has to be taken care of. So an ideal school health services comprises prevention of diseases. We will try our best that the children coming to the school, they should not suffer from any kind of diseases. If anybody is suffering from any kind of infection or showing any kind of symptoms, then he or she should be treated immediately, right? So these things are taken care of. Now, collection and maintenance of vital statistics. This word is very important. Vital statistics. All right. So vital statistic is the book keeping of records of public health. So in exam you might get like, what is vital statistics? So you have to know what is vital statistics. All right, so vital statistics is the bookkeeping of what? Of records. Of what records? Of public health. So public health is recorded where? It is recorded in a book. What is that? What is the name of that book? The name of that book is vital statistics. All right, so it is balance sheet of life, health and disease. So it is a balance sheet of life, health and disease. All right, it usually consists of records of birth. What does a vital statistics consist of? It consists the record of birth, death, illness and immunization. All right, the vital statistics give a fairly accurate picture of what? Of health and help in developing future plans. Now, what is health education? Of course, the subject we are studying right now is called health education, right? So health education is an integral part of all health programs. All health workers are equipped and trained to educate the people for maintenance and improvement of their health and for participation and cooperation in various health programs. So what happens? All the health educators, whoever is educating all the health workers, they are equipped or trained, and they are educated, and their work is to spread awareness to the local people, to the people of different societies, so that they can participate and they learn how to prevent, because we all know prevention is better than cure. So how to prevent the different type of diseases which might occur or outbreak. So those things are taught by the health experts. In addition to the above services, there are certain vertical national health programs such as malaria eradication. Malaria, you know what is malaria, right? It is caused by the bite of which insect? It is caused by the bite of mosquito. What is the name of that mosquito? Male or female? Of course it is female, right? The name is Anopheles, right? Then tuberculosis, control of tuberculosis, then smallpox eradication, etc. These would be eventually integrated with the health services of PHCs. What is the full form of PHCs? You comment. As the PHCs do not provide specialized services, they are linked up with institutions at higher level, that is tehsil, taluk, and district hospitals or centers. As I have told you that PHCs are not so much well equipped. It is just a primary health center, the basic health center. So it, it got a link. It got link with the taluk or the tehsil or the district hospitals, just like we have seen the PHCs of Samanda block, right? So it has got linked with the Williamnagar Civil Hospital, right? Great. So health setup in rural areas. What do you understand when I say rural areas? Is it town, city? No, it is not town, city. It is what? It is the rural, the village area. So a sub-center. See, we have already talked about primary health center, PHCs. Now we are talking about sub-center. What is a sub-center? You have seen already, right? I hope you remember. See, I will show you again. See, the primary health center is Samanda. All right, this Samanda is primary health center. But then, Samanda block. This is a block. Then primary health center is this one, Samanda, then Bansamgre, then Negmandalgre. These are primary health centers. But again, inside these PHCs, we have got sub centers. For example, if I talk about Negmandalgre, we have got 3 sub centers, smaller units. These are Rongbungre, Bolkhangre, and Samphalgre. So now we are going to talk about these things. So Rongbungre, Bolkhangre, and Samphalgre we are going to talk about. All right, let's see. So a sub center normally look after a population of about 10,000 people. So we know that a primary health center looks about a population of 60,000 to 1 lakh, right? But then sub center, they look at about 100, only 10,000 people, right? While selecting the village for the location of sub-center, consideration is given to the facilities such as water supply. See, whenever you want to set up a sub-center in a village, you should make sure that they have good water supply, then they have enough space for clinical staff so that they can, they can reside there, they can live there, they can get good quarters for the nurses, for the staff, then school, market, etc., which is nearby school, market, and so residents of midwife, school, market, etc. It should be accessible. What do you understand by accessible? Accessible means it should be reached. Suppose in all weather conditions, for convenient link between the PSC, majority of the people living in the area, all the basic health services provided by PSCs are channelized to community. All right, now it says that during rainy season also you should be able to reach to that PHC or sub-centers. During windy season also, during winter season also, during summer season also, during spring also, during autumn also, any weather conditions you should be able to reach that place. It should not be like there is no road during rainy season due to landslide, you cannot go to the sub-centers or PHCs. It should not be the case, right? It should be approachable, it should be accessible in all weather conditions. This is what the condition is for setting up a healthcare center in rural areas. Now, the medical officer of the PHCs, apart from giving medical care at PHCs, visit the sub-centers and other villages to provide medical care. Now, they are talking about medical officers. What do? Apart from giving medical care, they visit the sub-center. So who visits the sub-center? It is the medical officers, all right, and they provide medical care to the villagers. For these visits, they have pre-planned program to enable the various categories of health workers in the fields to inform the villagers who may wish to consult. See, in villages what happens, doctors, they are not available so much, so they go in a week or 2 times in a week, and those patients who have different type of problems, they can just come, like we do health mela, right? Health melas. So the doctors, different type of doctors, they go there, and the patient, they come to the doctor, they do the treatment, take the medicine, and go back home. Now, treatment is combined with health education. During these visits, the medical officer also supervises the work of the field staff such as the lady health visitor, public health nurse, auxiliary nurse, midwife, and sanitary inspector and instruct them to follow up the cases they have come across during their visits. In this way, medical officer keeps direct link with the community at large. Now what happens? See, health officer will not work alone. He works with other staff members, right? Like the lady health visitors, then public health nurses, then auxiliary nurse midwives, then sanitary inspectors. So they all join hands together and they work for the betterment of the villagers or the betterment of the rural population, right? So once the medical officer have seen the patient, the rest of the work or the follow-up work has been handed over to the other subordinates. All right, now referral services. The referral hospital services are generally inadequate in rural areas. Inadequate means not enough. To provide better diagnostic facilities and adequate treatment in rural areas, it is necessary to link the infrastructure of PHCs with hospitals. So this is what I already told you, that PHCs, they have got link with the civil hospitals. So it has therefore been decided that 1 out of every PHCs be upgraded to 30 bedded rural hospitals. See, that's why now it has been decided that PHCs should not be PHCs alone, because PHCs technically have only 4 to 6 bed, but it should be made into mini hospitals or small hospitals where at least 30 patients can be accommodated, where at least 30 beds are available for the patients, right? Now, healthcare setup in urban areas. So we have seen about rural areas. Now let us see how the people take care in urban areas. So the urban areas consist of big cities and towns. We know towns and cities, right? These consist of the urban areas. So each city or town has a local body to manage its affair. These local bodies are known as municipal corporations. So we all know municipal board, right? Municipal corporations are there. So municipal corporations. So what happens here in case of big cities, and municipal committees in case of towns. So we have municipal corporation for big cities, and we have municipal committees for small towns. Now the corporation have a fairly big health department for providing health care to its citizens through a network of hospitals and dispensaries. Now see, unlike the healthcare in rural areas, the healthcare in urban areas is quite better, very good, and the health workers are quite many. They are approachable all the time, right? They are reachable. Now all municipal committees have either a hospital or dispensary or both to provide medical care. These number of hospital dispensaries depend on the size of the town. Now every municipal committee, they have their own hospital, they have their own working staff, they have their own dispensaries to provide the medical care to the patients, right? Now beside medical care, these local bodies take care of the sanitation of the city, immunization of the population under their jurisdiction. Now see, beside giving medical help to the people, they also take care of the sanitation, the cleanliness of the village, of the town. Now they also help the people in getting immunized against certain type of diseases. The local bodies are also the agencies for promoting and implementing national health programs. So they are the ones who promote national health programs. Now some big towns also have hospitals and medical colleges run by the state or the central government, which provide better and specialized care. So as you know, in Meghalaya we don't have any medical college as of now, but I think we are going to have one in Ampati, right? So I hope I am right. If I'm not right, please correct me. So I think we are going to have a medical hospital in Ampati. Now, though the services for the urban areas mostly include the same functions as the rural areas, they are provided by various agencies. See, in order to clear my doubt, let us see, the medical hospital is coming up in Ampati or it's coming up in Tura. So medical hospital in Meghalaya. No, not medical hospital. I should write medical college, right? Medical college in Meghalaya. So I hope we will get No, I'm not getting that result what I want. I think in Meghalaya we don't have in Garo Hills or what. Let's see. In Garo Hills, Tura Medical College, Doldigre. Tura Medical College. Oh, so according to this, we can see the medical college coming up where? In Tura, right? In Doldigre. So the location you can see here. So, though the services for the urban areas mostly include the same function as the rural areas, they provide by various agencies. Medical care services are provided by various government and non-government hospitals. See, the medical care is given by both the private as well as the government hospitals. The MCH and family planning services are provided by the MCH centers set up by the government. We also have got MCH maternity hospital in Tura, right? In Babupara we have got that. Then local bodies and voluntary agencies. So school health services are made available usually through school health dispensaries run by the local municipal committee or corporation. See, altogether is just trying to say that the health facilities in town is very good as compared to the village. So vital statistics are collected from various general and maternity hospitals and cremation ground. Environmental sanitation and control of communicable diseases is the responsibility of the committee or corporations through the public health staff and departments of public health engineering. The entire area is divided into zones. See, the entire area is divided into different type of zones with a small office where you can report vital event and get inoculated. Special clinics or specific health problems such as what are that? Tuberculosis or leprosy or sexually transmitted diseases. Sexually transmitted diseases are also known as STDs are also available beside laboratory services for laboratory services are also available for testing food, water, drugs, medicines. All right. Beside the above mentioned agencies, there are other agencies to look after the health of the central government employees. See, we all want to work under the state government or the central government, right? Because we know there are different type of schemes or advantages given to the employee who are working under the government. So they get free health checkup, or they get DA, or they get TA, or they get what I also don't know, because I am not a government employee, so I have no idea as of now, but maybe in future I will have. So you know that, right? So different type of things we get when we work under the government. Now, healthcare and organized sector. Almost all people working with government agencies and big industrial organizations are covered by one or the other health scheme. Generally, people contribute a nominal amount for these services if they belong to any of these organizations. Find out from your parents the type of health facilities they have access to if they are employed with any other organization. So this is what we have just talked about. Those who are working under the government, they have got different type of health benefits, right? Now let us see indigenous system of medicine. What is that? Indigenous system of medicine. Indigenous means, what do you understand? Indigenous means local, right? The original. So far we have tried to know about the general structure of the health services that are present at various levels in our country. You must be aware that sometimes your parents, grandparents or neighbors prefer to visit Vaid, a Hakim or a homeopath. See, we have different type of treatments, right? Allopathy, then we have homeopathy, right? Then if the old people, the village people, long time back and even these days, what do? We directly don't go to the doctors, right? Allopathic doctors, because there are certain diseases for which if we go to the allopathic doctor, they will say you have to do the operation. So we try to find out the alternative, right? So what do? We go to the Hakims, we go to the Veds, or we go to the homeopathy. So homeopathy is also very popular, right? So we go to them and we talk to them and we tell them the problem and we try to get some solutions from them in order to treat the particular disease without doing the operation. So in our country, indigenous system of medicine serve a large population of our country. So it says that India is very rich. We have different type of medical systems, or we have different type of medical treatments, And especially those people living in villages, they are very lucky, you know, they can do self medication also. They know how to make use of the herbs, how to make use of the different type of, you know, uh, different type of herbs or different type of plants available, and make medicines out of that. Now, with the advent of modern system of medicine known as allopathy, modern system is like whenever you go to the this one, you know, the doctors, the medical doctors, those who study MBBS, you go to those doctors, that is called allopathy. You know, with the advent of modern system of medicine known as allopathy, we have neglected our own system for some time, and as a result, its systematic study has been neglected. Now you see, with the advancement of allopathy, MBBS, there is a lot of advancement in that, right? So that's why, you know, we have forgotten, we have, you know, underestimated the homeopathy, underestimated the Vedic system, underestimated the Hakim, underestimated the Oja system. So when we stay in we stay we stay in Meghalaya, right? And Meghalaya have got diverse, rich culture, and you know, we have got the Ojas, right? We have the Ojas or the Ved or the Hakim. In different language they call it differently. So we go to our Ojas in order to, suppose we have some different type of problem. Suppose somebody broke his or her bone, then we go to the Oja, and taking that Oja's medicine, the herbs, without any side effect, the natural medicine, it really cures and it really helps. The only thing is that you have to believe in the Oja, right? So we all know Ajksam, right? Ajksam. So what is Ajksam? Ajksam is also a form of indigenous system of medicine, which means we, the local people, we are taking those medicines from our local doctors. So the Ojas are our local doctors, right? So we go to them and they make the medicines and they give it to us, provided that we believe in that medicine and we take the medicine, we consume the medicine. At the same time, we have to believe it, right? So now, why the people, they don't, you know, the city people, they don't like Oja, or they don't like to take the medicines given by Oja or homeopathy. It is because they are asking us not to take certain things, right? Suppose when we are taking medicines from Oja or homeopathy, we are asked not to take non-veg, not to take oil, not to take pumpkins. So these things are asked by the Ojas, right, or the homeopathy. So that's why the people, they don't want to, you know, stop all this. They want to eat everything. So that's why they prefer allopathy. But it depends totally, it is totally your belief which one you prefer, whether you want to go to Oja, whether you want to go to homeopathy, whether you want to go to Hakim, whether you want to go to Ved. So it is totally up to you, provided it suits your system, whether you get the treatment, whether you are healed, whether you feel better or not, right? So according to our own interest, we do that. So this resulted in deterioration of their standard. Many quacks, see, who are quacks? Quacks are the people, you know, who, alright, I'll explain it to you, wait. Now, who are these quack? So these quack are the, you know, people who behave themselves as like doctors. They are unqualified, they are a fraud, and they loot the people. They say do this, do that, and you know, you will be healed, you will get the relief, or you will completely, these things will go. So these are what? These are the scammers, the scamsters. They do the scam, all right? They are behaving as if they are medical experts, but they are not. So these are the, what to say, fraud people who pretend themselves to be doctors. Quacks started practicing this system of medicine, thus further eroding people's faith in this system. So you know, we cannot say that, you know, quack are what? Quack are the people who have their own selfish interest, or they have their selfish interest in looting the people. They take the money from the people, they give the medicine, this and that. They have no knowledge, they have no qualification, they are just fraud people. But we cannot say, you cannot compare them with Oja or with Veds or Hakim or homeopathy. All right, our government has realized the importance. See what it says, the next line, this is very important. You see here, don't misunderstand here that oh, quack means Oja, or quack means Hakim, or quack means Ved. No, homeopathy, no. Quack is fraud, it's different. But let us see, our government has realized the importance of this indigenous system and has opened dispensaries, hospitals, and colleges for training. See, even the government is encouraging this Ved, Hakims, or homeopathy. The government is encouraging, and they are opening the hospitals, the colleges, the dispensaries, so that the people, they get treatment naturally, because the Ojas, the Ved, the Hakims, they are making the medicines from the original source, right? They are making the medicines from the plants, from the herbs, so from the fruits, from the seeds, from the roots, from the stems, from the leaves, right? Different parts of plant. So that's why even the government is encouraging them. But don't misunderstand it, quack is false. Quack people are false people, fraud people, right? But these Veds, Hakims, or homeopaths, these are good people. All right, now government of India has constituted statutory bodies like, see, what are the bodies? Central Council of Indian Medicine, another one is Central Council for Research in Indian Medicine, and homeopathy. Homeopathy is encouraged these days for all recognized system of medicine. The main function of these bodies are to maintain standards and promote research in these systems. Now see, homeopathy people, they don't believe in homeopathy, right? But you should believe if it suits your system, if your disease is treated. See, when people have different type of problems and they are asked to do surgery, where do they go? They go to the Ojas, they go to the Hakims, they go to the Veds, they go to the homeopathy doctors, right? And luckily, in a miraculous way, some people are treated. They don't have to do any operations, but they are treated by homeopathy medicines, right? So that's why many people, they believe in homeopathy. All right, so you can also try according to your own interest, whether you want to go for allopathy or you want to go for homeopathy. So you can study, you can learn about it, and you can research about it, and you can accordingly go if you need to see the doctor. Now, all right, things for you to do. So this, it's over, I think. Yeah, so these things you do it by yourself. So thank you everyone for staying connected with Ashok Tutorials, Meghalaya's first MTED channel. Thank you.